Can you tell us about your experience leading Rwanda's healthcare and how that led you to create the University of Global Health Equity? Tell us about what the mission is for this.
So the University of Global Health Equity has the mission to create a new type of global health leaders that will respond to the need of the community by focusing on the most vulnerable.
Is healthcare for all in Africa possible? And if it is, what do you think needs to happen in order for us to attain it for the people of Africa?
Participation and the right to health has to be the pillar of what you do.
Thank you for joining us on the HSS podcast with me, Lenias Hwenda. This is the Changemakers podcast series where we talk to leaders who are transforming healthcare in the African healthcare sector. Today, I'm in conversation with the former Minister of Health from Rwanda, Dr. Agnes Binagwaho, who is currently the Vice Chancellor at the University of Global Health Equity. And she was the Minister of Health between 2011 and 2016. She was also the former Permanent Secretary of Health between 2008 and 2011. Before that, she was the Executive Secretary of Rwanda's National AIDS Control Commission between 2002 and 2008, and she chaired the Global Fund's Country Coordinating Mechanism for Rwanda between 2002 and 2008. Vice Chancellor, welcome to the HSS podcast. It's really a pleasure for us to welcome you here today.
Thank you for having me. It's going to be an interesting conversation.
Wonderful, wonderful. The pleasure is all ours. So, Vice Chancellor, you have been a leader in the African healthcare sector for such a long time. And for many countries, many of our countries, I'm from Zimbabwe, we are facing so many challenges, a lot of which have been made worse by the COVID-19 pandemic. But in Rwanda, I was visiting Rwanda very recently, and you have made tremendous progress in so many areas of healthcare. Tell us, what is your view? Is healthcare for all in Africa possible? And if it is, what do you think needs to happen in order for us to attain it for the people of Africa?
So I think healthcare is for all over the world. It's not for Africa, for Europe. And this notion is in danger for multiple reasons. First of all, because to have healthcare for all, even in rich, it's not about rich or poor. You have seen so much inequities in rich countries, even worse than in our countries. We have seen global inequities, notably with the vaccine, with the 8% of African vaccinated when 50% of European are vaccinated. And those inequities are so dramatic because it's fabricated, it's structural, and it's known, it's planned. What I can say is that you need political will, that's for sure, but it's not enough. You need to have the know-how, how to build the health sector. And if you focus on the most vulnerable, even when you don't have the total know-how, you can always improve the health sector where we are, because you make sure that the most vulnerable are included in the benefit of what is available. And this is rule number one, inclusiveness. And for this, rule number two, always focus on the most vulnerable. For this, rule number three, multi-sectorial approach. Because health is not an issue of the health sector only. You need transport, you need radio, that means you need communication, you need finance, you need to be able to pay, you need to be able to reach there. So it has to be proximity care. You need to access, now we can save you at a very high cost for neurosurgery and you die with malaria. So what? Bad planning. So you need to give people access to primary essential healthcare, on this build secondary care, tertiary care, and even the research and quaternary care. So you need skills and the know-how to do that, and that's what we teach at the University of Global Health Equity. You need the political will and the humility to say, I don't know. Let's call people who knows. We do that to create machine. And a machine is also a system. Health system is a system. And if you create it badly, you will not create universal health coverage. And universal health coverage is giving to all the same, whoever they are, whatever the age is, whatever the place in the country they live. So it's a lot of work, but it's doable. Yes.
Well, that certainly is very positive, Vice Chancellor, because sometimes it is easy to be demoralized when we are looking at the challenges that our countries are focusing. But it's clear because, that you're doing it in Rwanda. It's so much progress in a lot of different areas. And you are saying that, they are steps, priorities that should be taken. Being inclusive is very important. Secondly, focusing on the most vulnerable and making sure that you don't make healthcare an issue only of the health sector because it affects the entire economy. And we've seen this with the COVID pandemic, where within a year of this pandemic, we lost economic progress of decades, 2 decades worth of economic progress, 2 decades worth of progress in the healthcare sector. And so it really demonstrates your point that this is not an issue of the health sector alone. But you talk about the need to generate skills and to say when you don't know and to be able to have the humility to learn from others. Can you tell us about your experience leading Rwanda's healthcare? And how that led you to create the University of Global Health Equity. Tell us about what the mission is for this university and where your vision is for the university in 10 years' time, 20 years' time.
That's a great and long question. So the University of Global Health Equity has the mission to create a new type of global health leaders that will respond to the need of the community by focusing on the most vulnerable, as I was saying, and the neglected member of the community. Because when those ones are included, you may be sure that the people who are well off will be included too, because they know their way. So our primary mission is to promote global health equity. And that's why you have equity in the name of our university, because we want to promote social justice. And when I say social justice, it's not a revolution or whatever, it's just give to each and everyone the right they have to be at the maximum of their potential. We cannot give health. There are some unfortunate situation where you give birth to a baby with some genetic problem. We cannot give health to everybody, but each and everybody should have the maximum from the society where they live and in an equitable way. So it has to be holistic. And I told you, holistic go with integration also, meaning you don't ask the people to go here to get HIV treatment and there to treat their malaria. Have a holistic health services and focus on community. And all along the pyramid of care, make sure you have great community health workers, but also great nurses at sector level. That's what we did in Rwanda. Each country have to adapt that to their administrative and health structure. But we have 4 community health workers per village elected by the people, trained by the Ministry of Health, standard training according to the burden of disease at household. We have also, they belong to the community. They are answerable to the community. The community has agency. They elect them and the community health workers report to them. The day they don't perform at the satisfaction of the community, they elect somebody else. And the Ministry of Health has to train the new one. So participation and the right to health has to be the pillar of what you do. Now, give holistic care to the people is another one. Multi-sectorial approach, I told you earlier that all the social determinants of health have to be tackled. And you have to embed your health plan and strategies in the national development plan and strategies of the entire countries, so that your Minister of Transport and the transport sector has the same objective for development that the health sector, the Minister of Finance, the financial sector, so that when you need to give financial access to all the nation, we are all together to create financial access, that people are not excluded because they cannot pay. And people who can pay, because health is not free. It's always somebody pay, but the government pay for the poor. Now you have, when I talk about transport, it goes together with geography and infrastructure. You need to, if you have community health workers in each village, you have health centers in all sectors. We have 416 in Rwanda and 500 health centers. Minimum one health center with nurses with degree in all sectors, around 25,000 people. Now in district, you have a district hospital with doctors. In province, you have provincial hospital with specialists. And in the region, you have the teaching hospital with high specialized care. Like this, the population can access the same quality care, whatever place they are in the country. And this is what we teach at University of Global Health Equity. Not only the Rwandan model, but the principle behind how to create a health sector, the decentralization, the equity, the taking into account all the social determinants of health. And when I talk about equity, we need to walk the talk. And we do that. For example, 70% of the students recruit in our medical education are female. Why? Because girls have more difficulties to enter in scientific track in Africa due to the culture, because those tracks are longer. They're not encouraged or supported. So the entrance of female students in medical school is less for girls than for boys. And at the end of the day, we have only 28% of medical doctors that are female. So for us, we take 70% of girls and 30% of boys in medical education, because it's equity, it's not equality. In other courses, we apply equality, mean 50-50. So equity is important. We have also the financial access to education. We believe that financial equity for access to care starts with financial equity to access to health education. So our students pay according to their capacity, but for the medical student, we go further. They don't pay at all, but they sign a contract that they will work where they are needed for the public sector in their country for 9 years, for their full salary. We don't ask reimbursement. We want them to turn the good education we give them, the knowledge, the skills, and the capability in good quality care and treatment for the people in need in their country. After 9 years of this type of services, we are happy. They have reimbursed. They can go where they want, with the hope that we have educated them with so goodwill to serve the development of Africa that they will continue to serve most of the case in rural area. Because in rural area, we miss doctors, nurses, like all the world, by the way. Even the rich world miss doctors and nurses. But in Africa, it's worse, because we have only 4% of the health workforce of the planet, and we have 25% of the burden of disease. But in rural area, the lack of nurses, doctors, clinicians, of all type of clinician is bigger. So that's why we have put the University of Global Health Equity in rural area, because the young people, after 6-7 years spent in cities, they are reluctant to go and work in rural area. They believe they became young people of cities, and they feel desperate to go and be reallocated in rural area where the needs are the biggest. So we have put our university in a rural north. It was one of the poorest districts of Rwanda 10 years ago. And there they spend happy time, 6-7 years, they know they can study there. So that's what we do. That is our mission. We know also that rural area in Rwanda is the same than rural area across Africa, but also across the world. So if we educate, now we have recruited young students from the region at the same condition for free, for medical education, but to serve 9 years those in need in their country.
I think that is a really ambitious and exciting, I think, approach to solving the health workforce challenge that we are facing chronically in every country on the African continent. In fact, some years back, I was part of the African delegation that was trying to negotiate on behalf of African countries how to balance the inequity in distribution of health workforce globally, where you have high income countries under-investing in training nurses and doctors with the plan that when they need more, they just take from low and middle income countries and, make up their shortfall that way. But I think I love your plan in that it gives people an opportunity, young people, students, an opportunity to contribute to the health sector, even if they don't have the means to afford the education, but at the same time, they commit to serving the communities. And I love the fact that, you are developing leadership that is responsive to the needs of the communities and looking at what's needed by people at all levels and being able to provide that. I think that is a model that would work in not just in African countries, but all over the world, because like you rightly point out, Vice Chancellor, this is a challenge that is facing every country globally, not just African countries. And I think every country taking steps to solve it this way might actually help with the challenge that in Africa, we have only 3% of the global health workforce because we lose so much of what we invest in.
You asked me what is my vision.
Yes.
My vision in 10, 20 years is that we are not an exception. We are the ordinary way to educate. And also what you say about brain drain, this is a colonial agenda that continue. They drain our riches, they drain our people, and we remain underdeveloped and under skills, and under the workforce in all areas are still so low that we cannot manage our continent ourselves, so they can continue to steal the riches.
Absolutely, absolutely. And I guess this is about, how we are going to redefine those boundaries in a way that allows us to regain control over the decisions we're making in our own health sectors and taking health care in the direction that would serve the people of our nations and of the continent. So I think this is a great vision, and we are willing for your success, because when you succeed, I think we will all succeed, because we can have a model to say that this is how it can work. It can be done. It's possible.
Yeah. And we have in football, my dear, a model of paying back if you steal my skilled people. Okay. When I have grow somebody, if you want to take one, you pay me.
Yes.
But for our doctors, nurses, lab technicians, etc., our PhD people, our people with PhD, sorry, honor, nothing. So this is stealing brain, and really take something that we could just do a law, international law, and say pay back. At least people are free to move. but pay the people who have educated them.
Yes, absolutely. It is an investment. Rwanda is paying to generate this resource of highly skilled health workforce. And you're right, this is done and accepted in other areas, like you mentioned, football. And yet we have tried, in fact, before to have a similar system to say, if you're going to underinvest in health workforce development, and you want to take from that country, then you must pay for that resource because that country would have invested. But that really was rejected very forcefully. And what is interesting for me, Vice Chancellor, is to explore, to take your idea further and see how that can be integrated in part of, let's say, Rwanda's bilateral relationships with other nations in terms of recruiting health workforce from Rwanda and across the continent, and having that clearly stated in the relationship. I think that would be very, very interesting. Now, you in Rwanda, you've made progress in so many areas in controlling neglected tropical diseases, reducing the impact of cervical cancer on women, and reducing the rate of HIV transmission, which is quite great a burden for, especially in young women, young girls across the continent in particular. In all of the areas of progress you've had in the healthcare sector, what are you most proud of?
I think there are many areas of which I'm proud of, because, and also all those are linked. Huh? You can see that all the health sector was destroyed after the 1994 genocide against the Tutsi. The social fabric of our society was really destroyed. The government worked intensively to rebuild the trust of the social cohesion by creating a governance system that relies on participatory decision-making process, and by promoting an equity agenda, as I described. Recreate the trust. And I told you about the system of community health workers in each village, health center in each sector, district hospital in each district. And this has significantly contributed to the success of the health sector. Note that a Wellcome Trust study in 140 countries showed that the public trust in Rwanda in the health sector is the highest in the world, meaning they have seen we have the best mark when we come in less than a generation from high distrust to the highest trust. And it has helped COVID-19 adherence of the population to the measure proposed by the government. Our health sector was also destroyed, but now we don't have the best health sector in the world, but it's the health sector the most trusted by the people. And I'm proud of this, the trust we have created. I'm proud of the equity as the center of all agenda of development, including the health sector. And we have financial equity with the health insurance, geographic equity with the administrating structure of the health sector in the country. And of course, we are still a country who have only $800 per capita, something like that. And people pay the health insurance according to their capacity. And it is the village who decide who can pay, who cannot pay, who can pay the maximum, what is $5 per capita. And who knows the people better than the people you live. So they do a list, they send that to the sector, who collect the list, send to the district, to the national. And you pay, or you don't pay, something like $12 per capita in your household, according to your revenue. And the revenue is because you have a bicycle, you have a telephone, you have a car, you have a land, you have a house. It's concrete things. So because we have created this system based on ownership of the community, it works. And we are the country where the voluntary access to health insurance is the highest in the world as well. Even if we cannot offer everything with that. So now the trust is what? Like the cervical cancer. Can you imagine that we bring that in 1 year? By creating the trust in this, we have explained to the woman their cancer. Cancer was not well known at that time. And even the woman knew that they had an uterus because there is a lot of prevention for the pregnancy, etc. But that very few people knew that women have a cervix. And the cervix, the cancer of the cervix, this part of an unknown part of your body, is one of the biggest cancer with the breast cancer. So we took 1 year to explain. We explained to the religious leader, to the parliamentarian, to the media, to the private, to the teachers. And when everybody got information, then we start vaccinated. And we had more than 93% of girls the family won't accept to vaccinate. And we explain we need to vaccinate before the first intercourse. Those are the studies done since 10 years, and we see that the first intercourse is at 12 years. So we are going to tackle the girls at 12 years in the classrooms. Yes. Everybody supported. That was a multi-sectoral approach that worked well. For HIV, we did the same. We create a system so that all across the country, we have clinics that are accessible at less than 1 hour for all. And they have the doses of the IRT treatment needed for the population they serve regularly without stock out. And everybody across Rwanda, you don't need to go in a city to have the same type of care. And this is what creates trust, cultivate equity, and cultivate the health of your population. For vaccine, we have the kids the best vaccinated on us, with 11 vaccines for the boys, at more than 90% of the boys, fully vaccinated for 11 antigen, and 12 for the girls because they have HPV vaccine. So you can go, all the prevention tool we have used it. All the innovation that exists somewhere in the world, we study it, we customize it, we bring it home, we implement it. And that's how we have better life expectancy than countries that are well off than Rwanda. And this is what everybody should do. And this is also a way to create a health system. The quality, the innovation, and the access. So I'm proud of everything.
Yes, yes. But the message that you have on equity as being, the foundation of actually achieving equity, bringing health closer to the people, empowering communities to take decisions about their health, electing their own leaders who represent them and speak out on their behalf, and working with them to make sure that children are vaccinated, women have information about cervical cancer, and the results that you're talking about that has come from that approach of putting equity at the center of everything and including the other sectors that should contribute their respective elements to that, to bring solutions. It really shows that when you give people information, they actually make the right decisions.
And it's your duty to inform. First of all, I was educated that never try to treat somebody about something you don't talk to the person, and the detail, the treatment you give. So the right to information is as important as the right to participation, because if you don't make people participate, they don't own. And if you don't inform, they don't own it properly. So that means information is so. In Rwanda, we had a so high level of illiteracy before, 20 years ago. Educating is a leader duty. You need to lead people at the best of their capacity. This is part of the human dignity we have made each and every Rwandan recover. We have a long way to go. I don't say that we have arrived, but those principles are key. If I come to you and say, you have fever, you have this, take this. No, you have fever, this is malaria. To prevent is because of this, and you take your treatment. Yes. People will finish correctly their treatment. Yes. You manage better so taking time to explain to the people, it's your duty, and it's part of respect them as human beings and treat them with dignity.
As a visitor, in my first time in Rwanda, I felt this dignity that you're talking about and the trust. I felt very safe in Kigali, even though I've never been there. I didn't know anyone, and I think it's that trust that really then spreads to all levels of society, and how people treat each other and how people treat even outsiders, and that has actually, knock-on effects on all the other aspects of social life and progress in the country. How have these improvements, Vice Chancellor, these improvements in health, how have they impacted the economy of Rwanda?
But first of all, when you know that you have leaders who care, yes, it gives you appetite and enthusiasm to be part of the journey, to work, to contribute to the development of the country. Because for a country like ours, you more than elsewhere, we need to fight corruption. The people contribute because they understand that if the money is stolen, it's their health that it's stolen. It's the money to pay for their health. So if you have this approach and those results, there is nothing better to incite you to continue than success. We are addicted to good results, and we want more good results. So success, and explain those success and explain the long way ahead, is the best. It's one of the best development tools that we can have to make each and every one come around an agenda, but also the way they are consulted for designing a plan, a strategy, national plan, national strategy. It takes time to consult each village, come back and come with the result again and come up again. It takes time, but the time you believe you lose doing that, you win that 1,000 times at the time of implementation, because everybody knows what is coming. Everybody knows the role they are going to play. And now it's going, it's flying. And people are happy, So those results has contributed to the development of the country. Those results has contributed to building the trust in the future. Those results has made the people understand that the future is bright. They have understood that the future is in their own hand. We doesn't have to seek necessary outside. Let's do first what we can do ourselves for ourselves, and seek support only when we cannot find our way. So it's a lot.
It's beautiful, Vice Chancellor. I think it's very simple principles that you have taken and simply put them into practice. You have given the people of Rwanda a stake in their own development, and everybody knows this is how this is what we want to do as a community, as a nation, and this is what I can do as an individual. That's really empowering people, because I often wonder, across the continent, one of the biggest problems that I personally see is our dependence on others. I travel in many countries, and the message you hear consistently, we have this challenge and we need, if only donors could come and focus on it. And you think, why can't we own our own challenges and finding those solutions and not look to others? And that is what you have implemented in Rwanda. And I think that is really, really exciting.
And behind that, we have put academic principle behind those process, and we teach them. And it's really so aligned with the social determinant of health and all. We stop to go for blah, blah, blah. Let's go and do it.
Yes.
and measure it.
Yes. It's like you said, walking the talk. You're walking the talk. You're not just talking about it. You're just doing it. And that's what we need to start doing more of, I think, in all countries on this continent.
Yes.
What gives you the most hope on the continent? You know, we have been doing so much work during this pandemic. One thing it has done has been to bring our leaders together, to put their heads together to solve some of those challenges that we have. Access to medical products, for example. What is giving you the most hope at the moment on the continent in terms of our progress or the steps we are taking to get on the path of sustainable development? And how do you see the University of Global Health Equity contributing to that vision you're building as our leaders on the continent?
So COVID-19 is really a human drama with so many deaths. But what gives me hope is that Africa finds its way alone. Just because travel were not allowed, so we came together, and under African Union and CDC Africa, there was a continental response that were really well talked about last week during the first continental public health conference in Africa. So now it was, when you say that people are in Africa, we have been so brainwashed by the colonialism and by the post-colonialism and by the continuing colonialism and by the white supremacy and the Black inferiority, that people, when they have a problem, always look to the Western world and the North to find a solution, not in what they can do. And COVID obliged them to do that now. And for the first time, Africa have decided to really build, construct, manufacture what they need for their own survival. HIV never bring that desire. All the drugs we swallow in Africa come from another place in the world. And we are among those who swallow the maximum of those drugs. And that's good. It saves our people. Why we have to buy that elsewhere? Why should we not build it? And in place to take from our money and go and buy elsewhere, or the money we have. Now, for the vaccine, we have not access. Only 8% of Africans are vaccinated. There is vaccine, but the rich countries are hoarding it with 1 billion on their stock. So many of them expiring. More than millions have already been thrown in the dustbin, expiring on their stock, but they are not ready to give it, to share with us on time. Now we are going to create and manufacture vaccine. And we have, for this, created the African Medicine Agency that is going to start working. We have created various partnerships with international organizations to build non-clinical workforce we need, and the clinical workforce we need. We are partnering to manufacture in Africa, led by the Africa CDC and the African Union. So for the first time in Africa, we are working up and say, let's plan for the future ourselves, looking with ourselves. But some countries have done that. It's not that it's the first time. But now as a continent, we are standing up and say enough is enough. We don't want to be served when you have what you are not using and be considered as the last on the queue. We want to be the first on our queue. And this is a revolution. It's a revolution in mindset. It's in the revolution of to brainwash again our brain and remember how great Africa was before colonialism. Yes. We had universities, gold, riches. At the time, Europe was in the Middle Age. We were defeated in battle and educated during more than 400 years that we are nothing. Thanks God that the Western world came and civilized us, when it's the contrary. Africa is on the move. Africa is standing up. Africa will care about its own future. And that gives me hope.
Wonderful. That is Dr. Agnes Binagwaho, the Vice Chancellor at the University of Global Health Equity and the former Minister of Health in Rwanda, talking to us about Africa taking charge of its own destiny and how our leaders are coming together to change the future of Africa by actually investing in it. Vice Chancellor, it's a pleasure to have you on our podcast. Thank you so much for coming on.
Thank you for having me, and stay safe and great festive season.